Welcome back. We are going to look at another aspect of health right now. Recently, I spoke with a doctor in Texas, Dr. Alan Rechter, about opioid addiction. Unfortunately, drug overdoses and deaths are on the rise, and there's some significant efforts underway to help individuals from getting addicted in the first place. Let's take a look at our conversation.
At a time when deaths from drug overdoses are on the rise, there's a new effort to help keep people from getting hooked on prescription opioids in the first place. The CDC released data reporting that more than 93,000 people died from drug overdoses in 2020, which is almost 30% increase from 2019. Here now to talk about the role non-opioid options can play in the surgical setting to help prevent opioid addiction before it starts is orthopedic surgeon from Orthopaedic Associates in Houston, Texas, Dr. Alan Rechter. Dr. Rechter, thanks for being here today.
Thank you for having me.
The nation is experiencing several setbacks as it struggles to tackle both an ongoing opioid epidemic and the national COVID-19 pandemic. As a surgeon, what do you think can be done?
Well, clearly, as a surgeon, I'm on both sides of that problem. So, doing surgery, which is painful, and then having to prescribe opioids to control the pain is one side of it. So you really have to be on the solution side as well. And if you think about the numbers out there, you're dealing with 50 million surgeries that are being done annually here in the United States. 2/3 of those patients will fill prescriptions after those surgeries. So you're dealing with a whole lot of medicine that is being flooded onto the market. So anything that we can do to decrease those numbers is a big win.
What has been the challenge in post-operative pain management for your patients who have undergone surgery?
I mean, simply speaking, is that surgery hurts. And, it's a painful thing. And we've really learned that the reason why there's so much pain on the front end is that there's an inflammatory response that occurs after the surgery itself. People expect that when they go to the dentist and have a tooth pulled, the swelling that people see in the chipmunk appearance, that happens there, but this really happens all over the body. And we had really decent local anesthetics that were good for 12 to 24 hours, really good, but the problem is it needed to go on for 72 hours, and we didn't have something to bridge the gap until now.
What can you tell us about the latest development in treating post-operative pain?
There was a medication that was developed by Heron Therapeutics called Zen Relief. I'm in partnership with Heron Therapeutics. This is not an opioid. It's not an injection. It's not a pill. It's a product that is actually applied at the time of surgery. Earlier this year, the FDA granted indications to be used in total knee surgery, bunion surgery, and hernia surgery. It's put in at the time of surgery, and it's mixed with this local anesthetic and this anti-inflammatory. So when people are having that inflammatory response that I just mentioned before, it would really mute that. So we were having patients, just to be honest, were coming to the office that would normally take 60 to 90 pain pills. I think that would be considered standard after knee replacement. I mean, if you think about it, you're using a hammer and a saw in there. So it's something that we know is usually going to be painful. But in these patients, they were taking less than 10. And we had some patients that had taken none, which is really unheard of. But when you're talking about the good, you need to speak about the bad as well. There's always potential interactions when you're dealing with medications. And when you're dealing with local anesthetic, there's always some potential allergies and things like that with that. With the anti-inflammatories in general, there's always potential risk with the cardiovascular or the GI system. But these two medicines that have been used in this product are ones that have been on the market for over 20 years with a very good safety profile.
How does this latest development signal a major change in post-operative pain management options?
I mean, in essence, it's knocking out pain. You're treating patients. They're not seeing the needs for those medications. So it's been highly effective in that regard. I mean, specifically with knee replacements, where you're dealing with more than 1 million of those being done a year, and you can imagine if you can take the numbers down from 60 to 90 per patient to 10 or less, then really you found something that's highly effective.
And what other factors would you like our audience to know about in regards to this?
I think as a surgeon, our job is to deliver results, and having a person that's miserable is not really the result that you're looking to deliver, but we have a solution for that now. So if there was a patient that was looking at doing or having one of those surgeries, whether it be a knee replacement, hernia, or a bunion, it's something that they should speak to their physician about now that it's available. There's also full prescribing information that's available and more information on the internet. They can look that up at zenrelief.com, and it's spelled ZYNRELEF.com.
Well, thank you so much, Dr. Alan Rechter, for joining us today from Houston, Texas, with this important information about opioids and other options for pain management. I appreciate it.
No, thank you.